Hello, everybody. It's Victor with Cardiac Wire, and today we'll be talking to the team from HeartLung about their AutoChamber AI platform and how it helps detect cardiomegaly in asymptomatic patients. With that, why don't you introduce yourself, starting with Dr. Cloner?
Thank you very much. My name is Bob Cloner. I'm a cardiologist and a professor of medicine at the Keck School of Medicine at USC, and the chief science officer and director of cardiovascular research at the Huntington Medical Research Institute in Pasadena, California. I've been most interested in myocardial ischemia, myocardial infarction, and therapies for reducing damage during ischemia reperfusion, as well as diagnosis of myocardial infarction.
Dr. Wong?
Hi, and I'm Nathan Long. I'm a cardiovascular epidemiologist by training and professor and director of the Mary and Steve Wen Cardiovascular Division's Heart Disease Prevention Program at the UC Irvine School of Medicine. And I specialize in preventive cardiology and have had a long-standing interest in early detection of cardiovascular disease, going back to pioneering work I did with coronary calcium going back to the early 1990s, and have also been involved in a number of large-scale cardiovascular disease prospective studies, including Framingham and Mesa and others over the last 35 years, and also do a lot of work with looking at cardiovascular outcomes in people with diabetes.
Thank you, Dr. Wong. Dr. Henschke?
Hi, I'm a chest radiologist at Mount Sinai in New York City. And together with the team, you'll hear from David Yankelevitz, we've been doing lung cancer screening, low-dose CT screening for lung cancer since 1992. We have developed an international collaborative network, and we believe in looking at all of the findings that we see on that low-dose CT, and that includes the rest of the lungs, the heart, the bones, and the other organs. So we've always believed in reporting everything and giving as much information as possible for use for preventive medicine.
Dr. Yankelevitz?
Hi, I'm David Yankelevitz. I'm a thoracic radiologist at the Icahn School of Medicine in New York City, and I'm working with Claudia Henschke on lung cancer screening since 1992. We have probably the world's largest screening program or collaboration, and we have been deeply interested in the areas that we'll be discussing today, especially cardiovascular and how we've integrated cardiac calcium scoring into the low-dose CT screening. We introduced that many years ago, and we also have a large interest in the evaluation of lung nodules and other findings on the scans.
I'm Morteza Nagavi. I'm the founder of HeartLung, the company that has a unique collection of brains from cardiology, radiology, pulmonology, and computer science engineers in one place. That's a unique cross-bridge that we've created, and we refer to our group as united by one thing, a chest CT scan. And this primarily, I give credit to Dr. Henschke and Dr. Yankelevitz for their work, and Dr. Reeves for their work on early detection of calcification in lung cancer screening, which they started. They kind of bridged to our world, cardiology, where I am primarily trained in. And then our interaction resulted in building what now you see as a whole set of AI solutions to bring those to preventive imaging. And if I just jump over the next 10 years, we envision that this effort could change the preventive medicine for decades to come, because now we have a tool that can be integrated in primary prevention of diseases, not just lung cancer, not just heart disease, not just osteoporosis, but diseases that could be detected early by a chest CT, low-dose chest CT scan say at age around 40, and repeat it over time. So HeartLung's mission is to bring that vision to patient care, early detection for years to come.
Wonderful. Thank you so much for those introductions. And just getting right into it, Dr. Kloner, as a cardiovascular researcher, in your view, what value does AutoChamber AI bring to cardiovascular care and preventative medicine?
I think it brings a lot to cardiovascular medicine, but I have to give a little bit of a background. So we know that both cardiomegaly and enlargement of certain chambers of the heart, including left atrium, left ventricle, as well as an increase in left ventricular mass, have been recognized as serious issues that can develop into symptomatic disease at some point in time. But we've never had really a tool to detect them in non-contrast CT scans like calcium score scans or lung cancer screening. So HeartLung Technologies did not really invent the field or the science, but the tool to detect these abnormalities in cardiac chamber size. Now, enlarged left atrium, left ventricle, and an increase in LV mass do not have symptoms initially. So these patients often remain asymptomatic until they experience overt heart failure with enlarged left ventricle, or they develop complications related to these abnormalities in chamber size, such as atrial fibrillation and stroke associated with an enlarged left atrium. We know that every year there's millions of people who have chest CT scans and coronary CT angiograms in the United States. And unfortunately, most of these cases do not get reports of chamber volumetry, chamber volumes. But with this AI, artificial intelligence, can enhance the value of their CT scans or their CT angiograms, not only for coronary heart disease prevention, but also for looking at the possibility that these individuals might develop things such as heart failure when the left ventricle is enlarged, the left atrium is enlarged, as well as determination of development of stroke when left atrium is enlarged and atrial fibrillation when the left atrium is enlarged. So this whole field is really allowing us to look at chamber sizes in which previously they were not observed. They were not detected because we didn't have AI, and now we do have AI. And so a lot more information can come out of the CT scans and the CT angiograms that are done.
Well, it's really exciting to know that these imaging modalities are giving us even more information thanks to the application of AI. Moving on a little bit more specifically to type 2 diabetes, Dr. Wong, I know you were involved in a lot of the studies with type 2 diabetes and AutoChamber. Could you tell us a little bit about the take-home message for practitioners from those studies?
Yeah, certainly. So what AutoChamber has shown already is that people with diabetes are at increased risk of heart failure, in general. Okay. But we also know that if they have enlarged chambers detected by an AutoChamber, that they're at even greater risk, right? So it helps identify our very high risk people with diabetes. But what's interesting, what we found was that people without diabetes who have enlarged chamber sizes are actually at similar risk as those with diabetes who don't have enlarged heart chambers. So it really offers us an opportunity to help identify people with diabetes who are at increased, with those without diabetes who are at increased risk due to enlarged chambers. So this is really going to help prompt better risk factor management, such as better blood pressure control, to help prevent further enlargement and development of heart failure in people with diabetes. And if I could also add to Dr. Kloner's very nice comments just about, the overall impact that AutoChamber AI might be able to bring to the field. We certainly know that there's many people, over 19 million people annually in the United States, who are getting CT scans, oftentimes for other reasons such as lung cancer screening. And the fact is that many of these individuals would not otherwise have their cardiovascular risk detected. But we now have an opportunity through AutoChamber AI to help detect people who may be at increased risk of cardiovascular complications, including coronary artery disease, stroke, heart failure, and atrial fibrillation, as was nicely pointed out, who may not otherwise be identified. So we can therefore treat these people earlier by more aggressively intervening to control their cholesterol, to control their blood pressure, that can help to prevent these complications from occurring. So it's really a missed opportunity not to use this type of new technology to identify people at increased risk.
Well, so it's interesting you mentioned that it's a missed opportunity. I'm curious, in your view, what challenges you foresee for the mass adoption of AutoChamber and what you suggest for addressing those challenges to prevent that missed opportunity.
Yeah, so certainly with these newer technologies and the valuable findings that are almost every day coming out of them from newer papers, such as from AutoChamber AI, we need to first educate the clinician community about the findings and about the utility of this technology and how it can be applied, including to people who have already gotten scans. We can actually bring up these scans that were done 3 months ago, 6 months ago, or a year ago, and we can we can do these assessments and to inform our patients about their potential risk. Now, second, it's very important that we have to continue to promote these findings through both our existing and future publications that are in important cardiology peer-reviewed publications to the scientific community, because what's really needed is that future expert panels as well as guidelines will adopt this technology. So, that's going to be very important for this to be used more widely in the medical community. And certainly there's a number of publications that have already come out in high impact journals with our technology that is, I think, really nicely paving the way towards us.
I was going to add one thing. I agree. I think the key here is educating physicians, but also eventually educating patients and educating the general public that there is now a technology available that when they have a chest CT or a coronary angiogram, that there's now this opportunity to obtain additional data, additional information, which is going to look at the size of their chambers in the heart. And once that is done, we will find out whether they are at risk of things like heart failure, stroke, atrial fibrillation, and then we can address therapy for those individuals. So I think it becomes an issue of educating both physicians, healthcare workers, as well as patients.
While we're here, Dr. Cloner just touched it. About 3 million people every year, approximately, get coronary CT angiography. They're actually right in front of cardiologists and in cardiovascular care domain, and they get evaluated for coronary stenosis, any kind of plaque analysis, CT-FFR. They're already in cardiology domain, and unfortunately, we're missing this population from giving them information about their future risk of heart failure or imminent risk of heart failure, a stroke, and atrial fibrillation, because their chambers data is not analyzed. They're just coming, they get their CTA, they get a coronary angiogram report or a BAS plaque analysis in CT-FFR, and they go. And that important part of data, because coronary artery disease is about half of heart failure, a stroke, and atrial fibrillation. So we leave so much, close to half of the information related to prevention of cardiovascular poor outcomes in cardiovascular disease within the cardiovascular clinics today on the table. We're not using them. Now we go to opportunistic in the other 19 or 10 plus million CT scans that Dr. Wong referred to that are not cardiology patients, either from emergency room all the way to pre-op to any other infectious related in pulmonology scans, all the way to lung cancer screening.
Thank you so much, Dr. Wong, Dr. Kloner, and Dr. Nagavi for giving all of that background. It's really rewarding to get to hear and listen about all of that. With that in mind, we'd like to move on a little bit to talking about the lung screening applications of AutoChamber AI. Go ahead and tell us a little bit, Dr. Henschke, about what your view is on the value that AutoChamber AI brings to radiology and preventative imaging.
Well, thank you for the opportunity. Lung cancer screening is approved for people aged 50 and older who are smokers and former smokers. Now, those we know that we can detect lung cancer early and we can really have a high cure rate. But the vast majority of those going to, or many more, are going to die of cardiovascular disease and COPD, particularly cardiovascular disease. And so this chamber analysis allows us, at the same time that we're looking for early lung cancers, to give information about the cardiovascular status and whether they should talk to a preventive cardiologist. We think this is a tremendous opportunity to really save many lives, not only from lung cancer, but also from cardiovascular disease by finding it earlier.
Do you have anything to add to that, Dr. Yankelevitz?
Yeah, I'd like to say that what I think all of the group that has spoken is saying is that I think that we're at the dawn of a new era of preventive health. And I think the low-dose CT scan of the chest is probably going to be the primary test that's going to lead that. And you're seeing now the number one cancer killer can be found with screening, and now the number one killer, heart disease, where we're just opening the doors right now. So this is going to be a massive change in preventive health. I think that basically this is leading the way to the way medicine will be practiced in the very near future. This type of preventive approach is, I think, going to change everything we do. And chamber analysis is a major component. This has really not been done in a serious way before, where it really can be done on just low-risk people for this disease, people that, or I should say, people that are asymptomatic and we're not suspecting. And I think we're going to be finding, certainly we're going to be finding several of the major cardiovascular illnesses here: heart failure, atrial fibrillation, stroke. We're going to be able to predict. So I think this is just going to impact the way we do medicine going forward.
And this was really what we've been trying to do for the last 20 years, because we wanted to fully integrate cardiovascular disease detection with lung cancer screening.
And just one other comment, you're seeing now the preventive cardiology world and the lung cancer screening world really coming together on this. I think that by itself is an enormous accomplishment. Everybody is seeing the value in this now.
I'd like to add here that Dr. Henschke and Dr. Yankelevitz helped us bring cardiologists, preventive cardiologists, even interventional cardiologists, and lung cancer folks, radiologists and pulmonologists under one room, where we presented last September the first conference on integrating early detection of heart disease and lung cancer. And that was a great 3-day conference in New York. The proceedings and the audio video presentation of the conference are available both through our website and International Early Lung Cancer Action Program, ILCAP, nonprofit organizations that they've been working on for the last 40 years. So in summary, the AutoChamber is just the first that crossed the finish line and received FDA breakthrough designation and marketing authorizations. But as you can see right behind me, and what Dr. Yankelevitz thought, is that all of these biomarkers that are information within the same chest CT scan. I quote Dr. Henschenke's early interview like 30 years ago, a treasure trove of vital information, of life-saving information that's there, and now it becomes available because of AI. Because AI can do the whole thing in less than 1 minute, then if he had to do or she had to do it, first of all, manually, reading 500 slices to calculate chambers volume, just that would have taken a week, let alone 10 other items. So that's really the magic of AI coming to prevention, early detection, and the LDCT platform enables us to get there. So lung cancer screening, people, majority of them would die with heart disease and COPD, as Dr. Henschenke said. And this would add a tool to alert them, go to get early detection and treatment for cardiovascular disease prevention.
Thank you for that background. I'm curious, as the founder and leader of HeartLung, what challenges do you see, Dr. Nagavi, to bringing AutoChamber AI to patient care?
Echo what Dr. Kloner and Dr. Wong said, basically education, because the most important step here is we educate our clinicians so they understand for a long time. I mean, everybody knows LVH, left ventricular hypertrophy, is bad, but nobody had an easy way of dealing with it, reporting it, and evaluating and monitoring. So the same thing with enlarged chambers. Everybody knows enlarged heart is bad, enlarged cardiac chambers bad. So that's where we are educating, developing the guidelines and the recommendations for practitioners. That's the science and education part. Then the execution part, of course, that's really the biggest challenge, is to get it into massive networks of radiology PACS providers. There are countless of them out there, to be able for them to become aware. One unique advantage that we have, which is very really rare, and that is both of our solutions that are currently available, AutoChamber, which got FDA breakthrough, and then AutoBMD, that reports bone density, both have Medicare reimbursement, especially for AutoChamber because it was just released a month ago, about a month and a half ago, by Medicare, because they realized the value of this. So these are upside, but really the main challenges are education and access to distribution channel, where we could get this in front of hospitals, radiology groups, to be able to run the scans. 12 or data varies between 12 to 20 million CT scans of chest alone in the US. Of course, we have abdomen that also could be used for bone density. And every year they add up. So and as Dr. Wong said, if you had enlarged cardiac chambers or cardiomegaly 6 months ago or a year ago or 2 years ago, chances are you already have it now if you didn't get treated, if you're unaware of the condition. So there's truly tremendous amount of value that could be untapped if this AI is unleashed on the existing CT scans. And our challenge is the education, what to do with the results, and then distribution, how to get this to hospitals and diagnostic imaging center.
Well, Dr. Nagavi, it's good to hear that you have a game plan for addressing those challenges and broadening AutoChamber's reach. I'm curious, does HeartLung have any future plans to offer new AI solutions for preventative healthcare?
Absolutely. As you can see behind me, this scan, this illustration may not be very clear, but the center of it is a chest CT scan, could be a cardiac scan or a lung scan. And there are about 10 different reports that could come from it. Each of them would have a specific action items. So for example, on the top, you'll see liver fat. We have just published in the past 2 months from our data using NIH-funded multi-ethnic study of atherosclerosis. These are patients who had no symptoms at the baseline, healthy, apparently healthy people, followed for 20 years. Within their calcium score scans, we were able to measure an index of liver fat and showed that those people who fell in the top quartile of our measurement, liver attenuation index, LAI, had significantly higher cardiovascular events rate versus other people. Now, within the same group who got scanned, if they had higher calcium score and higher liver fat, their risk was even greater than each alone. So liver fat is one of them. Bone density, which you will be covering in another topic interview, that is also a key. And there's an interaction. If you have low bone density and high calcium score, you are in a worse situation than either alone in terms of cardiovascular outcomes. So there is interactions between. But of course, measuring calcification in coronary arteries, measuring calcification in aortic wall, those are all different modules that comes out. Measuring calcification in aortic valves. As you know, this is a new field. It's just growing very fast. 2 or 3 drugs are rushing to a finish line with FDA for aortic calcification prevention, which is phenomenal because we don't have that. We just wait for people to get really, really sick, and then we put them on surgery table. So those new drugs will need our AI tool for early detection of aortic valve calcification. Then you have aortic volume or diameter measurements for detecting aortic aneurysm and preventing those aortic aneurysm to become aortic dissection and rupture and so on. So there's a large, in pulmonary artery, of course, if you have problem in your lung, emphysema, pre-COPD, other interstitial lung disease, your pulmonary artery will change because of the pulmonary hypertension. In the diameter is one of the AI tools that we have. We report pulmonary. And I have to credit here Dr. Anthony Reeves from Cornell, who was collaborating with Dr. Henschke and Dr. Yankelevich for several decades. A lot of these works he published early days, before deep learning was even known, and he used computer to measure. So machine learning taught computer how to identify these anatomical markers and do measurements. So most of these things that we have here are bringing cutting-edge deep learning AI solutions to things that they were practicing for many years manually or with some computerized techniques, but that could not have been adopted as a mass tool because you need to have it very fast, easy, reproducible with guidelines and value and reference cutoff points. And that's what HeartLung has in its pipeline. Hopefully over the next year or two, we'll be able to get FDA clearance for all of these modules that you see behind my screen and bring them to patient care.
Well, it's a very exciting pipeline, very robust, and we're looking forward to hearing and reading more about it. Thank you so much, Dr. Nagavi, and the rest of the HeartLung team for all your time today. I've been Victor. This is Cardiac Wire.